Hello students. Today we will discuss about diagnosis and treatment planning in complete denture patients. Content. We will discuss about introduction, diagnosis involving patient evaluation, clinical history taking, clinical examination and next investigations. Next we will see the treatment planning and the adjunctive care. Introduction. Diagnosis. Diagnosis is derived from the Greek word dia, means apart, and gnosis means knowledge. Diagnosis is also defined as the determination of the nature of the disease to determine the type of disease and further its treatment planning. Involves three steps: accumulation of the information, analysis of the information, and the final is the making of the diagnosis of the disease. Next, treatment plan is the sequence of procedures planned for the treatment of the patient after diagnosis. Both diagnosis and treatment planning is important for the success of the result. Diagnosis involves patient evaluation. Patient evaluation considers gait and posture of the patient, complexion, cosmetic index, mental attitude. This we will further discuss in elaboration. Clinical history taking involves name, age, sex, occupation, race, location, religion of the patient. Next is the dental history of the patient. Then we will ask chief complaint, history of present illness, period of edentulousness, pre-treatment records, medical history, debilitating diseases, disease of joints, cardiovascular disease, diseases of skin, oral malignancies, and next is the neurological disorders. Clinical examination extraoral and intraoral. Extraoral involves the facial examination, muscle tone and development, complexion, lip examination, TMJ examination, neuromuscular examination. Intraoral examination involves existing teeth, mucosa, saliva examination, consistency of the saliva. It involves residual alveolar, redundant and hyperplastic tissues, hard palate, soft palate and throat form, bony undercuts, gag reflex, tori, muscle attachment, frenal attachment, tongue examination, and floor of mouth examination. The further investigations involve the radiographic examination and investigation, current denture examination, diagnostic cast examination. Now we will see in elaboration form in detail the patient evaluation. First step to be carried out in treating a patient is the gait. Gait should be observed as patient walks inside and evaluated. Neuromuscular coordination can be evaluated by the patient's gait. Now next is the complexion and personality, which helps to determine the shade of the teeth. Mental attitude. Mental attitude or psychological evaluation of the patient. The psychological evaluation of the patient according to the house, the dentist should meet the mind of the patient before he meets the mouth of the patient. The psychological examination is classified as philosophical, exacting, hysterical, indifferent. Now, the philosophical patient is well adjusted, cooperative, confidence in dentist and has excellent prognosis. Exacting. Exacting patient is above average in intelligence, dissatisfied with past treatment, doubt the dentist's ability, once satisfied becomes dentist's greatest supporter. Now, hysterical patient. Hysterical psychological patient has negative attitude, often in poor health, have unrealistic expectations, and the result is poor prognosis. Indifferent patient psychology often go without dentures for years, do not adapt well to the dentures. Now clinical history. Clinical history involves the name. Name. Name has a significance as identification, and good communication brings confidence and psychological security. Next is next is age significance. It as indicator of the patient's ability to wear and use a prosthesis. Patients in fourth decade of life has good healing abilities. Patients more than fifth decade of life above the fifth decade of life has compromised healing. Some diseases are limited to certain age groups. For example, as we can see, oral cancer and precancerous lesions, hypertension, and cardiac problems are more common in elder patients. Next, sex. Sex. Female patients are more critical about aesthetics. Male patients are generally bothered about comfort. Sex related disorders, osteoporosis, especially post menopausal in females. Address. It should be recorded for future communication with the patient. Occupation. Executives and sales representatives, more idealistic teeth, people who work in place with high physical exertion, rugged teeth, higher income, have greater expectations, busy people, more critical about comfort. These are certain categories based on the occupation of the patient. Now, the location. Endemic disorders like fluorosis confined to certain localities. People from the locality characterization for a natural appearance. It is depend on which localization you live or in which area you reside. Now the next is dental history. Dental history involves dental history involves the chief complaint, history of present illness, expectations, pre-treatment records, previous denture, pre-extraction records. Now next is the history of present illness. It is the course of patient's chief complaint important in ascertaining a proper diagnosis and treatment plan. Expectations. Dentists should evaluate the patient expectation and classify them as realistic or attainable and unrealistic. Pre-treatment records include information about previous denture, pre-extraction records. Previous denture, reason for the failure of the prosthesis, we can be known. The patients who can keep changing dentures in a short period of time are difficult to satisfy. Pre-extraction records help in photographs, tooth selection, and arrangement measurement of teeth jaw relation. Now comes the medical history. Medical history. It is an information gathering process for assessing patient's health status. Hospitalization, allergies, transfusion, serious or significant illness, medications. Now, debilitating diseases, diabetes. Diabetes has oral manifestations involving dry filling in teeth, coated tongue with swollen edges, fissures on the tongue, small abscesses throughout the mouth, a faint odor of acetone in advanced cases. Diseases of the joints involve. Next is the diseases of the joints. It involves most common disease osteoarthritis, which affect TMJ, limited mouth opening and painful movement of the jaw. Next is the cardiovascular disease involving the heart. Always advisable to consult the patient's cardiologist before commencing treatment. Patients require shorter appointments suffering from cardiovascular disease. Neurological disorders. Bell's palsy and Parkinson's disease influence denture intention and jaw relation records. Disease of the skin. involving pemphigus. Oral manifestations vary from ulcers to bullae, such as painful conditions make the denture use impossible without medical treatment. Oral malignancies require radiation therapy before prosthetic treatment. Now, clinical examination of the patient. First comes the extraoral. Patient's head and neck region should be examined for any pathological condition. Including facial examination, examination of muscle tone and development, lip examination, TMJ examination, neuromuscular examination, lymph node palpation. Facial examination include facial features, facial form, facial profile, lower facial height. Now in the muscle tone we can classify into class 1, which is normal tension tone and placement of muscles of mastication and facial expression. Class 2, approximately normal function but slightly impaired tone of muscles. Greatly class 3 is the greatly impaired muscle tone and function. Now facial examination. Facial examination involves perioral features which involving length of the lips, lip fullness, apparent spot of the lips, philtrum, nasolabial fold, mentolabial sulcus or labiomental groove, labial commissioners and modules, width of the vermilion border, texture of the skin rough or smooth and light color. Now facial form. Facial form according to House and Loop, Frisch and Fisher and Williams, it can be classified as square, tapering and ovoid. Now facial profile. Facial profile can be normal, class 1 as normal, in which both maxilla and mandible are in a straight line. Class 2 profile is retrognathic, in which the mandible is behind the maxilla or the lower jaw is behind the upper jaw. Class 3 facial profile is the prognathic file of the patient, in which the mandible is front or more anterior to the maxilla, as we can say that lower jaw is more anterior to the upper jaw. Now lower facial height is important to determine the vertical jaw relation. Decreased vertical dimension leads to wrinkles around the mouth, and excessive vertical dimension, the facial tissues appear to be stretched. Now next is the complexion. Complexion is the color of the eyes, hair and the skin guide the selection of artificial teeth. Pale skin color is indicative of anemia and should be treated. Lip examination involves spot, adequately spotted or unspotted, mobility, thickness, length and competency. Now the lip thickness can be thick, medium, thin. The lip mobility can be classified class 1 normal, class 2 reduced mobility, class 3 paralysis. Lip competency involves competent or incompetent lips. Competent lips are closed. In the appearance of the closed mouth, the lip will be in contact to each other. In incompetent lip competency, the both upper and lower lip will not be in contact with each other. There may be a little space or more space between them. Lip length. Lip length can be long, normal or medium, short. Long lip reveal little interior teeth. Short lip allows display of denture base. TMJ examination. TMJ should be examined for range of movements, pain, muscles of mastication, joint sounds upon opening and closing. Severe pain in TMJ indicates increased or decreased vertical dimension. Next is the palpation of TMJ. We can palpate TMJ by lateral or posterior palpations. Lateral palpation involves light pressure on the condylar process with index finger. Then palpate both sides. Register any tenderness to palpation of joint and any irregularities in condylar movement during opening and closing maneuvers. It as in simple we can say that we have to place the index finger on the condylar portion of near the front of the neck, and then we have to ask the patient to open and close the mouth, and if there is any sound or crack we can hear or feel, then there is a TMJ abnormality. Coordination of action between left and right condyle heads assessed at the same time. Posterior palpation, position of the little finger in the external auditory meatus and palpate posterior surface of condyle. During opening and closing of mandible, palpation should be carried out in such a way that the condyle displaces the little finger when closing. Neuromuscular evaluation. Neuromuscular evaluation involves speech normal or affected if impaired, requires special attention when placed anterior teeth and forming palatal portion of denture base. Coordination should be given as excellent, fair or poor. If good, learn to adjust to the dentist relatively quickly by the patient. Now intraoral. Intraoral examination involves arc size, arc form, arc size, arc form, ridge parallelism,